Hello, everybody. My name is Hattie Gussin, and today I will be talking about my research topic of how intense an exercise routine should be to positively influence the health of adults dealing with obesity. My thesis is obese people should not surpass moderate level training in order to improve their health because other intensities could either be ineffective or lead to serious injuries and health risks. With the obesity epidemic becoming more prevalent than ever, this topic is important because its findings allow us to strip unrealistic expectations on what obese people should or should not do. Everyone's body has its own limitations, so knowing where to draw the line can help a lot of these obese people stick to a routine without overexerting themselves and getting hurt, such as a heart attack or a stroke due to their high blood pressure. Or maybe they suffer major joint pain in the knees and ankles due to their already weak joints becoming overstressed. So that's basically the bulk of what I'm going to be talking about today. So, what exactly do I mean whenever I say moderate level training? Based on the American College of Sports Medicine guidelines for exercise training, a moderate level routine would be around 150 minutes of aerobic training a week, which would be stuff like biking, swimming, or walking. 2 sessions of resistance training a week, which would be weightlifting or resistance band workouts, and 2 sessions of flexibility training a week, which would be either dynamic or static stretching. Dynamic stretching is movement stretching, so it could be like high knees, and static stretching is stationary stretching. So if I asked you to touch your toes and hold it. These numbers can vary going higher or lower, but it's very important that people try to stick to these and don't dramatically increase their workload. Like, let's say an obese person goes from 150 minutes of jogging one week to 300 the next. That would be very dangerous and will cause an injury to their body because their body isn't used to all that stress on it. There's already a ton of stress due to their weight, so you don't want to keep adding on more, you know? So, even though it might be scary, training is very important to losing fat and gaining lean muscle. And as a result of losing fat and gaining lean muscle, it'll lower their blood pressure, joint stress, cholesterol levels, chance of organ disease, and just so much more. So let me show you evidence for this on the next slide. These three charts are all from a study conducted with 298 women, both middle-aged and old. They were on a proper diet with aerobic training 4 times a week for 6 months, and then leaving them on their own for the next 12. This is all just to see the effects of weight loss. On this right chart, you can see their weight in kilograms. This top left chart, their LDL cholesterol levels, and this bottom left chart, their systolic blood pressure levels. You can see if we look at the weight chart, at month 0, they're at their highest weight. At month 6, they're at their lowest weight, which makes sense since they were on a workout routine and proper diet. And then at month 18, they had a little bit of weight regain, but definitely not where they were whenever they started. This could be because they didn't stick to their routine or their diet as strictly since they weren't really monitored. So, yeah. These graphs are important though because it shows the effect of healthy weight loss on other aspects of cardiovascular health. Because, as you can see, at month 6, at their lowest weight, they were at their lowest cholesterol and blood pressure levels, which is huge for cardiovascular health in obese people since they tend to have higher blood pressure and cholesterol levels. Again, it's huge for cardiovascular health that they lose weight because if these things are down with a combination of other cardiovascular aspects, it can be huge for reducing obese causing cardiovascular diseases or emergencies, such as like a stroke or heart disease or anything like that. So now that I showed you the benefit of moderate level training, let me show you why obese people should not go past this recommended threshold consistently. Like I said in the previous slide, as an obese person, existing health problems are already a big risk. Exercising is already pushing on these health complications, so that's why it's important to be careful working out as an obese person. Let's use blood pressure as an example. A study shows that blood pressure rises during exercise due to increased cardiovascular demand and oxygen uptake from working muscles. This is the reason why obese people can't risk doing as much as as a healthy adult, because there's just too high of a chance that their body literally gives out and the organ stops working properly. Also, already talked about the weak joints obese people have. So the amount of stress put on them is a lot. So putting more stress for for an extended period of time is just the perfect recipe for injury. Now, the reason obese people get discouraged or choose to go past these moderate guidelines and get hurt is because of a huge misconception a lot of people have. They think the solution to obese people losing weight is just to exercise more. It's really not that simple. In reality, it could be more harmful in most cases. Like, imagine a regular person trying to train with a professional athlete. Obviously, the regular person wouldn't keep up and would possibly hurt themselves since there are limits to how much each person's body can do. This misconception stems from doctors telling patients to exercise more. And even if they give them a recommended routine, not explaining the why behind this routine allows people not informed on this topic to think more exercise equals more results, not knowing the harm working out can possibly do if not careful. It's a doctor's job to inform patients on how working out will benefit their health, because this would just allow people to understand it's not as simple as just working out more. So some people might think that as long as you're in a caloric deficit, you'll lose weight and that'll fix the issue. Though, whenever you're in a caloric deficit, you do lose weight, not all of it is going to be fat. Some of it's going to be muscle. So you have to work out in order to retain and gain that muscle. So a diet by itself won't grant much results, but pairing a diet with exercise will immensely increase the results of losing weight. To show that exercise is a crucial factor in losing weight, a study was conducted trying to inspect the effect of dietary weight loss alone compared to the combination of dietary weight loss with aerobic and resistance training. Patients were given a 6-month intensive phase to undergo the study and a 12-month follow-up. The results showed that the patients who went through an aerobic and resistance training experienced greater quality of life and satisfaction with physical function, greater walking self-efficacy, and greater stair climbing efficacy than the group of patients who only went on a diet with no training. This just proves how a diet must be paired with exercise in order to achieve optimal results of weight loss. So to sum everything up, in conclusion, obesity is a rising issue that must be dealt with. And the first step in tackling this problem is identifying how to work out safely and effectively. Obese people can do this by adopting a moderate exercise routine, which would cause them to lose fat, which in turn will benefit their other parts of the body, such as the cardiovascular system, the kidney, or other organs. But making sure not to go too much past this will ensure that there are no other health risks or injuries. So here are my references, and thank you all for watching. Have a good day.